Hello, it's Colin Sweeney here, Director of IT at King's College Hospital. This is my second video diary in June 2011. Today I'm going to concentrate on the information revolution and the current lack of an NHS IT strategy. As many of you know, the consultation of the information revolution closed in January. But like many people who commented and responded to the questions, we still await an ICT strategy. Does that actually matter? Well, of course, most organisations will have their own IT strategy, and King's are no different. Through the years, we've stuck to our strategy based on the principle of information being available to all those who need it, where they need it, and when they need it. This is the way we are moving forward to our paperless hospital. However, we now have to work a lot closer with our colleagues in the NHS, and as an academic health sciences centre, we recognise the need to share information with our colleagues. So Guy's and St Thomas's, South London and Maudsley and King's College London. And as a result, we are developing our own strategy to do this. Naturally, we also want to look further afield and talk to our partners in other healthcare partners to share information as part of the wider healthcare community. And in South East London, we are also talking to the other community services, the GP practices, and we're looking at things like integrated care pilots and shared portals. This, though, is where we start to feel there is a need to be a consistent approach across the NHS. We would look to the NHS-wide strategy for sharing our information with other organisations. If you don't have such a thing, then you go through the risk of doing what we've always done, which is devise our own solutions, which can be inconsistent and ultimately mean that the poor users either have a multitude of different systems and solutions to access, or require significant numbers of different interfaces, which ultimately becomes unsupportable. The information revolution also talked a lot about giving patients access and giving them more control over their records. I think this is a very important part of any future strategy, as we need to know what is to be expected, we're expected to be providing, and what the information is required and how it will be accessed, what can be changed and by whom. Again, we don't want a situation where patients have to go into different systems depending upon who they need to access the information from. We also need to know about the plans of some of the contracts that we have signed up to. Last year at King's we migrated to NHS Mail, as it's a secure means of transmitting information between NHS Mail users, and we use it currently for communicating with GPs the details of our discharge notifications and other letters. So it is an important part of our strategy, but we need to know what the future of that is. Similarly, other colleagues have contracts with other parts of the old national programme, and we need to understand what's going to happen about those. What we're concerned about, of course, is whether the costs are actually going to come back on the NHS organisations, individual organisations, and we don't want to go through the situation which we've recently going through with the Microsoft Enterprise-wide agreement, where ultimately we seem to have to pay for the service when we thought it was going to be free in the first place. Similarly, there are other services that we need to look at. So, for example, the new NHS network, N3, which we are looking at ways in which we can actually benefit from that further. So looking at voice over IP, video conferencing. But how can we make any decisions if we don't know what the future is and what the strategy is in the long term? One of the other items that have come up in recent years has been the interoperability toolkit, which sounds a great idea, and I'm very encouraged by it when it first was introduced. We need to know more about what the strategy is for the future and how we're expected to link into it. Obviously, over time, other things come out of left field, and we need to know what's going to come there and what we're unaware of. So yes, I think the sooner we have a new NHS strategy, the better. Thank you.